You know, sleep is supposed to be our time to heal, a chance to rest, recharge, and forget about all the little aches and worries of the day. But what if your sleep is trying to tell you something? Something dangerous, something your brain is whispering before it's too late? Last winter, my friend Harold, he's 72, woke up at 3 a.m. He said his arm had gone numb. He thought it was just a pinched nerve. Maybe he slept funny. So he shook it off, went back to bed. 2 days later, Harold had a stroke, a real one, and now he's still learning to speak again. Turns out the numbness was a warning sign, a nighttime stroke symptom, one of many that older adults often overlook. According to the CDC, 1 in 4 strokes happen during sleep or right after waking up. And most people miss the signs because they expect drama, not subtle whispers in the dark. But here's the truth. Your body can give you warnings while you sleep, and if you pay attention to them, you might just save your brain, or even your life. So in this video, we're going to talk about 7 strange, often ignored nighttime symptoms that could mean a stroke is coming. Let's start with the first one. Something that might have happened to you before, but you never thought it could be serious. Let me tell you a story. A few months ago, my neighbor Harold, he's 74, woke up in the middle of the night. His wife, Clara, had gently shaken him and said, "Honey, your face looks uneven, like one side isn't moving right." Harold blinked, still half asleep. He noticed a strange buzzing sensation in his left hand, like it had fallen asleep. But here's the strange part. He hadn't been lying on it. He was flat on his back. His arms were relaxed. No pressure, no awkward angle. But still, he couldn't grip Clara's hand. Now here's the part that most people would ignore. He didn't feel any pain, just that odd numbness and a strange heaviness on one side. Most folks might say, "I probably just slept funny." But in Harold's case, that numbness was a warning, a quiet, early sign that something was going wrong in his brain. You see, when numbness or tingling happens only on one side of the face or arm while you're sleeping, and you didn't put pressure on it, that's not normal. That could be a silent stroke symptom, and it often happens without dramatic signs. Now let's talk about what's going on inside the body. While we sleep, our blood pressure drops naturally. That's normal. But for many older adults, especially those with narrowed arteries or high blood pressure, this drop can trigger something dangerous. It can cause a brief blockage in the brain, a tiny clot that stops blood from reaching an area that controls movement or feeling. In Harold's case, it affected the area responsible for sensation on the left side. He was lucky Clara noticed. But here's what's scary. According to the American Academy of Neurology, up to 20% of all strokes happen while we sleep. They're called wake-up strokes, and nearly half of them go unnoticed or untreated because people feel fine once they're fully awake. So ask yourself, have you ever woken up with one arm or half your face numb, and you didn't sleep on it? Because if you did, and it lasted more than a minute or two, that's a red flag. You might be wondering, how do I know if it's serious or not? Here's the difference. If it's just your hand or fingers, and it goes away fast, fine. But if the numbness includes your whole arm or your face, and it lasts more than 5 or 10 minutes, or it comes with other signs like slurred speech or feeling dizzy, then it's time to act. And don't wait. If this happens, even if it goes away, call your doctor. Or better yet, go to the emergency room and ask for a CT scan. Time matters. Stroke treatments are most effective within the first few hours. Now I know this might sound scary, but knowledge is power. Harold and Clara didn't ignore the signs. They went to the ER that night. The doctors found a small blockage in his brain, a transient ischemic attack, or TIA. It didn't leave lasting damage, but it was a warning, and it gave them the chance to prevent something worse. So if you ever wake up and something just feels off, if your hand is numb but your position was normal, if your face feels strange but you're not sure why, listen to your body. Sometimes it doesn't shout. It whispers. And if we pay attention to those whispers, we might save our lives. Would you like me to continue with number 2 in the same detailed, ready for voiceover style? Let me ask you something. Have you ever woken up in the morning, opened your mouth to speak, and the words just didn't come out the way you expected? Not because you were tired, not because your throat was dry, but because your tongue felt heavy. Your voice sounded off, like your brain knew what it wanted to say, but your mouth didn't get the message in time. That's exactly what happened to a woman named June, she's 78, who lives down the street from me. She told me, I got out of bed, went to say good morning to my cat, and instead, I mumbled something that didn't make sense. I even laughed it off, but deep down, I knew something felt wrong. Now here's the thing. June didn't have a headache, no numbness, no chest pain, just a few seconds of slurred, jumbled speech. It passed quickly, but that short moment, it could have been her only warning sign. You see, speech is controlled by the left side of the brain, especially in an area called Broca's area. It's responsible for forming words and organizing language. When a clot briefly blocks blood flow to that region, even for 30 seconds, you might experience slurred speech, trouble finding words, or even saying the wrong words without realizing it. It's not always dramatic. It's not like the movies. Sometimes it lasts 30 seconds, sometimes just a minute or two. But that's all it takes for your brain to send you a message. Something is not right. According to the National Stroke Association, sudden speech difficulty is one of the top 3 early signs of an ischemic stroke. And yet, many seniors ignore it, especially if it happens during the night or right after waking up. They assume, I was just dreaming. My mouth is dry. I haven't had my coffee yet. But here's what most people don't know. Waking up with slurred speech is not normal. In fact, a study from the journal Stroke found that people who experience speech difficulties during sleep or right after waking are twice as likely to suffer a major stroke within the following 48 hours, unless they seek immediate care. Why? Because these are often transient ischemic attacks, or TIAs, mini-strokes that warn of bigger events ahead. The blood clot dissolves quickly, and your speech returns to normal. But the damage is already being done, silently. So what should you do if this ever happens? First, don't dismiss it, even if it clears up. Try repeating a few simple sentences. For example, say, today is Wednesday. I feel fine. If your speech is off, or if you notice that words sound strange, call a family member right away. Don't wait until breakfast. Don't wait until you feel better. If you're alone, take a moment and look in the mirror. Check if your face looks even. Try lifting both arms. And then, call your doctor. Or better yet, go to the ER and request a stroke evaluation. Because time saved is brain saved. June was lucky. She went to the ER later that morning. Doctors found early signs of narrowing in her carotid artery. She got treatment, changed her diet, and started walking every day. Today, she speaks just fine. And every time we chat, she says, I'm so glad I didn't ignore it. So please, if your words ever come out wrong first thing in the morning, don't brush it off. Because when it comes to stroke, the earliest signs are often the quietest ones. Let's talk about something that often gets overlooked. Headaches. We all get them from time to time. Sometimes from dehydration, sometimes from stress, and yes, sometimes from sleeping in the wrong position. But what if I told you that a sudden, severe headache that wakes you up in the middle of the night could be your brain's way of screaming for help? That's exactly what happened to my Uncle Frank. He's 72, used to be a construction supervisor. Tough guy, rarely complained about pain. But one morning he called me and said, "I had the worst headache of my life last night. It woke me up out of a dead sleep. I thought maybe it was my pillow or tension in my neck, but it felt wrong, like a lightning bolt behind my eye." Now here's what many people don't realize. When a headache strikes suddenly with no clear cause and feels more intense than anything you felt before, that's a red flag. Doctors even have a name for it: thunderclap headache. It peaks within seconds. And in older adults, it can be a sign of a hemorrhagic stroke, when a blood vessel in the brain bursts and causes bleeding. And here's the scary part. This often happens during sleep or in the early morning hours, when blood pressure naturally rises and weak vessels are more likely to rupture. According to the American Heart Association, nearly 40% of hemorrhagic strokes begin with a sudden severe headache, especially in people over 60. And yet, most people ignore it. They take a Tylenol. They lie back down. They wait. But with stroke, every minute counts. Brain tissue begins to die within minutes of bleeding or oxygen loss. So what should you do if this happens? Here's how to tell if it's just a headache or something much more serious. Did the pain wake you up suddenly out of sleep? Does it feel different than your usual tension or sinus headache? Is the pain sharp, intense, or radiating behind one eye or one side of the head? Are you also feeling dizzy, confused, or nauseous? If you answered yes to any of those, don't wait. Go to the ER. Ask for a CT scan or MRI. Insist on a full stroke workup. Uncle Frank did, and thank goodness he did. They found a small aneurysm ready to rupture. He got treatment in time, and today, he's back to hiking with his grandkids. So please, don't ignore that strange, painful wake-up call. Because when your brain is in danger, it won't always give you time to figure it out later. You know that feeling. You open your eyes. Everything seems fine. But the moment your feet hit the floor, the room spins, your balance feels off, and for a brief second, you don't quite know where you are. Most people chalk it up to just getting older, maybe low blood sugar, maybe dehydration. But for seniors over 60, this morning disorientation can be something much more serious. A silent warning that your brain isn't getting enough oxygen. Let me tell you about Mary. She's 69, recently retired, loves gardening and making homemade jam. One morning, she stood up from bed and nearly collapsed, not from weakness, but from a wave of dizziness and confusion that lasted nearly a full minute. Her husband brushed it off. "You probably stood up too fast." But Mary knew something didn't feel right. So she went to the doctor. And guess what? She had experienced a transient ischemic attack, a mini-stroke, during the night. It didn't cause paralysis, no slurred speech, just morning confusion and balance problems. Here's why this matters. During sleep, blood pressure drops. But around 4 to 8 a.m., it naturally begins to rise. And if your arteries are stiff or narrowed, as they often are with age, that rise can trigger a small clot to block a vessel in the brain. This leads to temporary loss of blood flow, especially to areas controlling balance and orientation. And while these symptoms may fade quickly, the underlying damage doesn't. According to research published in Stroke Journal, more than 1 in 3 seniors who experience mild balance issues in the morning are found to have cerebrovascular insufficiency, reduced brain circulation that raises stroke risk significantly. So what should you watch for? Feeling like the room is spinning when getting out of bed. Trouble walking a straight line in the first few minutes, needing to sit back down due to dizziness, temporary memory gaps, or fogginess in the morning. And if you've experienced any of those, don't assume it's nothing. It could be the first warning your brain is sending. Here's what to do. First, keep a journal. Note the exact time and frequency of symptoms. Second, get a carotid ultrasound to check for narrowing in the arteries that feed the brain. Third, talk to your doctor about morning blood pressure spikes, a known risk factor for early morning strokes. And finally, never hesitate to ask for a stroke screening if something feels off, even if it's just a little dizziness. Because for people like Mary, listening to her body made all the difference. Today, she's healthy, active, and she never skips her morning walk, but only after drinking water, rising slowly, and doing a few stretches first. Have you ever woken up in the middle of the night, not because of a bad dream, not because you had to use the bathroom, but because your heart was racing? No pain, no shortness of breath, just a pounding pulse in your chest, loud enough to keep you from falling back asleep. Many seniors ignore this. They say, "Maybe I was just anxious," or "I must have been dreaming." But waking up between 2 and 4 a.m. with a sudden, irregular heartbeat can be much more than stress or poor sleep. It can be an early sign of atrial fibrillation, or AFib. And here's why that matters. AFib is one of the most common heart rhythm disorders in seniors. But what most people don't realize is that AFib can happen only at night, when you're lying flat, when your nervous system changes gears during deep sleep, or when blood pressure dips and rises suddenly. And the scariest part, AFib doesn't always come with symptoms. No chest pain, no fainting. Just a few nights of disturbed sleep, a racing pulse, and maybe some morning fatigue. But during those irregular beats, blood can pool inside the heart, especially in the left atrium. That pooled blood can form a clot, and that clot can travel straight to the brain, triggering a major stroke. According to the American Heart Association, up to 30% of strokes in older adults are linked to undiagnosed atrial fibrillation. Let me share a story. Tom, a 73-year-old veteran, started noticing his Fitbit logged a heart rate spike around 3 a.m. He felt fine during the day, but after a few nights of restless sleep and early waking, he mentioned it to his doctor. An overnight Holter monitor caught it, paroxysmal AFib, only at night. He was immediately started on medication to regulate his rhythm and thin his blood. And today, he hasn't had a single episode in months. So how can you tell if this might be happening to you? Watch for waking up with a pounding heart, fluttering sensation in your chest, sudden sweating without a reason, feeling anxious or wide awake in the early morning hours, lightheadedness when standing after a restless night. And here's what you can do. Check your pulse when you wake up. Place your hand on your chest. Is it steady or irregular? Use a wearable device to track nighttime heart rate trends. Ask your doctor about a 24-hour ECG monitor or a sleep study with cardiac tracking. And if you're diagnosed with AFib, don't panic. Treatment is available. And most importantly, early detection can prevent a life-threatening stroke. Because when your heart speaks at 3 a.m., you need to listen. 6. Waking up with one side of the body. Feeling weak or numb, and it's not from how you slept. You wake up slowly. Open your eyes. And as you try to push yourself up from the mattress, something feels wrong. Your right arm doesn't move the way it should. Or maybe your left leg feels like it's still asleep, even after you've been awake for several minutes. Your first thought might be, "Oh, I must have slept on it funny." That's a common assumption. But here's the thing. True numbness or weakness that doesn't go away quickly isn't from pressure. It might be a sign of a neurological event happening during sleep. And in seniors, this is often the first warning of a stroke. Most strokes don't happen with dramatic pain. They happen silently, often during the night, when blood flow to the brain is already lower. And if a small clot blocks one of the arteries feeding the brain's motor cortex, the area that controls movement, you might not notice until you try to get out of bed. Here's what to watch for. One arm or leg feels heavy, slow, or weak. Tingling that lasts longer than 5 to 10 minutes. A feeling of disconnect between your brain and a limb, like it won't respond the way it should. Needing help to stand or walk right after waking. Let me tell you about Alice. She's 78. Last winter, she told her daughter, "Every few mornings now, my right arm feels weak for about an hour. I think I sleep on it wrong." Thankfully, her daughter insisted she see a neurologist. A scan revealed that Alice had experienced 2 transient ischemic attacks, TIAs, mini-strokes, while sleeping. One of them affected the region controlling her dominant side. She was lucky. No permanent damage. But now she's on medication. Her blood pressure is under control, and she hasn't had an episode since. Here's what you should do if this happens to you. Don't shrug it off. Even if the sensation fades, tell someone. Write it down. Note the date, what side was affected, and how long it lasted. Test your grip and balance. Try squeezing both hands or standing on one foot. Call your doctor. Ask if it's time for a brain scan or carotid artery check. And most importantly, remember this. Sleep shouldn't make your body weak. If something doesn't feel right the moment you wake up, your body could be telling you it needs urgent attention. Because when it comes to stroke, the earlier you act, the more life you save. 7. Unusual deep sleep, hard to wake, even with alarms. You know your body better than anyone. You know what a normal night's sleep feels like, and you know how easily you usually wake up, maybe with the sun, maybe with a soft alarm. But what if one morning you don't wake up at all? Not until someone shakes you, not until the room is bright and loud. And even then you feel confused, groggy, and heavy, like you've been pulled up from the bottom of a deep ocean. That's not normal. Sure, we all have the occasional restless night followed by deep sleep, but when you suddenly begin sleeping too deeply, so much so that loved ones have trouble waking you, or you sleep through alarms you usually hear, it might be a red flag. Why? Because this kind of extreme sleepiness can happen when the brain has experienced a silent stroke during the night, especially in areas that regulate consciousness and arousal, like the thalamus or brainstem. In fact, research from the Stroke Association in the UK has shown that nearly 1 in 7 strokes happen during sleep, and are often only recognized hours later because the person couldn't wake up properly. Let's take James, for example, age 82. He never had trouble waking early, always up by 6:30 reading his newspaper, drinking black coffee. But then, over a few weeks, his wife noticed he started sleeping until 9, even 10. She tried calling him, shaking him, setting louder alarms. He just kept sleeping. At first, they thought, maybe he's just tired. He's getting older. But then came the confusion, the slurred speech, the weakness in his right hand. A hospital MRI confirmed he'd had a lacunar infarct, a small, deep stroke in the part of the brain that regulates wakefulness. Here's what to look out for. Unusual difficulty waking up even after 8 to 10 hours of sleep, excessive grogginess upon waking, beyond normal morning fatigue, feeling disoriented or off balance when finally awake. Sleeping through alarms, phone calls, or noise you'd normally hear. And here's what you should do. Don't dismiss it as just a deep sleep, especially if it's new. Ask someone close to observe you for a few mornings. Do they notice changes? Track your sleep with a simple notebook or sleep monitor. Talk to your doctor if you're experiencing prolonged morning grogginess, particularly if paired with memory issues or mood swings. And remember this. As we age, It's not always pain or dramatic symptoms that signal a problem. Sometimes it's just a change in routine, a shift in how we sleep, how we wake, how we feel in those first quiet moments of the morning. Pay attention, because the earlier you recognize those whispers, the more likely you'll avoid the storm. So now you've heard them. The quiet warnings your body may be sending at night. Not dramatic, not loud, but deeply important. A numb hand that doesn't wake with you. A tongue that stumbles before your thoughts do. A headache that doesn't feel like any you've had before. Confusion when all you did was sleep. These are not just aging. They're not just tiredness. They may be your brain's early cries for help. The truth is, nearly 15% of strokes happen while we sleep. And by the time we wake up, sometimes the damage is already done. But here's the hope. If you recognize these symptoms early, if you listen to your body when it whispers, and if you act, not tomorrow, not next week, but now, you could change the outcome. You could protect your independence, your memory, your ability to walk, speak, and live fully. So if you've experienced even one of these signs lately, don't wait. Talk to your doctor. Ask for a stroke screening, and let your family know what to watch for. Because a good night's sleep should leave you feeling refreshed, not disoriented, weak, or silenced. Take care of your nights and your mornings. We'll take care of you.